the university president came down to see me. I had no idea till that moment how close personal friends we were. And when I went to my office, the voicemail was jammed with requests for interviews from the New York Times, the Lair News Hour. And then there was one of my Norwegian friends, a voice, I'll never forget. The voice said, Peter, we've just heard the news. It's unbelievable. Pause. Then he comes back on, no, we believe it. So it was a kind of crazy morning. But driving home that night, getting home, Carly, our youngest child, was home, and she was only 14 at the time. And I was afraid this was going to be a burden to her. And I asked her how it had gone at school that day. And she smiled and said, well, my friends tell me this is so cool. And I beamed. She said, but you have to realize, you've never been on The Simpsons, really famous people that are on The Simpsons. So you got to put it in perspective. It was a memorable day, to be sure, Peter. Any other questions? Yes, sir, in the back. I think they'd like you to use the microphone.
Well, just speak real loud.
Have you, on the Institute, been involved at all in any research on the Zika virus?
Very good question. Zika, because of the recognition that microcephaly is linked to Zika, it's now not just a mosquito that bites and passes a virus, which is not very serious for most cases. So our institute is not directly working on Zika, but the basic work on mosquito biology will lead, we hope, to better understanding how to prevent the Aedes genus of mosquitoes, to prevent them from transmitting dengue fever, chikungunya, and Zika. So we're optimistic. It's not clear how this is going to help in the short term. A simple antiviral vaccine is very likely to emerge in the next year. So yes, we're at work on it, but we haven't dropped our other projects because of that. Thank you for your question. Yes, please.
How do you choose the countries that you work in?
Yeah, I guess it's not exactly from the travel section of the New York Times. I think most of the decisions were made by Vaughn Tarikian, a wonderful young scientist, an atmospheric scientist who started this program at the AAAS, working with Norman Neureiter, a former science diplomat, the first American scientist diplomat in Moscow and Warsaw. And it was in part through the opportunities. I didn't mention the first trip, which was to Syria, and that was led by David Baltimore, who was president of the AAAS the year before I was. And that trip went well. And there was a lot of enthusiasm, and met even with Bashar Assad, who assured the group that if he could create peace with Israel, he would do so, but could not say so publicly. Well, unfortunately, things have not gone well with Syria. The others, I think, Vaughn and Norm, based on opportunities, meeting members of the Castro family who are scientists who led us to the invitations and other events, and sometimes just the pixie dust of a Nobel Prize. The North Koreans were reluctant to invite us, and when they thought a laureate was coming, it became possible. Vaughn, by the way, is now the scientific advisor to John Kerry, the Secretary of State. Another, yes, sir.
I'm currently working with Help Age International on a health project in the middle of nowhere, Kenya. And I know from having visited there many times, the number one thing people come in for the treatment, these are very poor villagers, is malaria. Has the Institute considered joining on a project that would look to develop best practices on how to not simply prevent through malaria netting, but other ways to reduce the incidence of malaria, which is really, really big in Kenya?
Sure. Kenya has a terrible malaria burden. We are not working in Kenya because we thought we had to restrict our activities to a more local region. But there are wonderful agencies working in Kenya. And I think to distribute aid is a sign of our warm-heartedness. But are we delivering it in the most efficient manner? And are there simple mechanisms that could be delivered that are not used at all? I think that together the likelihood is we could continue to drive down the burden of malaria. And we're down from 2 million deaths a year 15 years ago to 500,000 a year presently. So good progress has been made, but 500,000 children dying every year and several million being left blind or epileptic, learning disabled is simply unacceptable. So I think what you're proposing is very worthwhile. And a lot of effort really is being made by the American public in forms of the President's of Malaria initiative. So I think a lot of us were skeptical of the George Bush presidency, but his President's Emergency Plan for AIDS Relief and the President's Malaria Initiative started wonderful activities which are helping the progress that we're seeing. There's a lot of wonderful work also done by the religious communities. Lutheran World Relief, the Catholic Relief Services, the Methodists have a program. And I think all of it together has been very helpful, but we still need to do more. And the cruel reality is if we back off, the disease comes right back. It's like crabgrass. You don't only have to take care of your lawn, you have to worry about the neighbor's lawn. Thank you. Oh, someone here then. Yes, sir.
I'm not in the science world, I'm in the business world. Have you considered partnering with someone like Product Red does for the AIDS? They've been able to raise $350 million to eradicate AIDS in Africa. Would it help your organization to partner with an organization like that?
I think the malaria field could benefit for sure. I think we're a research organization, and the funding has so far been satisfactory from both the Bloomberg source and from the National Institutes of Health. We have an International Center of Malaria Research. And we see ourselves as not aid providers, because that's too big a scope, but scientists looking for the mechanisms to provide aid most efficiently. So I think there certainly could be a role, probably not to invest in the Johns Hopkins Malaria Research Institute directly, but if you have some ideas, I'd love to pursue it. Thank you. Yes, sir.